Earlier in the series, we met hill walker Leonard Fletcher, who was shocked to hear he needed a hip replacement at the tender age of 55.
About 5 years ago, I had acute pains down my leg, in my groin, in my arm, always with me, day and night.
Doctors diagnosed osteoarthritis, for which hip surgery is the only solution. Surgeons used a special metal-on-metal hip joint rather than the usual metal-on-plastic to give Leonard's new hip a longer life and extend his newfound flexibility.
Flexes right up to here, so he can easily squat down for his amateur dramatics, and that will enable him to restore his hill walking career as well.
Now, Leonard, that operation was about a month ago.
It was.
You actually watched it. What was it like watching yourself there on the table being operated on?
Very interesting indeed. It was an image I'd never seen before. You know, you see photographs of yourself when you're a kid and an adult, and you look in the mirror and you see lots of images of oneself, but this was the first time I'd seen myself on the slab, like a piece of meat, really. And it was food for thought, makes you reflect, which is very positive.
Did you have a vision of what it might be like before?
I did, yes. Yes, liberal smatterings of blood around the place.
Very liberal.
Yes. Very liberal, yes.
And we have the man himself. Come in, Marcus. You performed the operation, and is that what you replaced Marcus's old hip joint with?
Yeah, this is the implant that Leonard has. It's a metal-on-metal hip resurfacing, and as you can see, I can spin it around very nicely.
Can I have a little go on it?
Certainly. It's very low friction, but it's even...
It's heavy.
Yeah, it is quite heavy, but as I say, because it's actually at the axis of rotation of the hip joint, the patients don't actually experience it as weight actually in the leg. It's because it's at the hinge, as it were. But it's even lower friction, actually, because actually inside Leonard's body there's actually a fine layer of fluid trapped between the articulating surfaces. So it's like oil actually lubricating the hip.
Wow. And we've actually got some X-rays here of Leonard's pelvis and hip joints here. So I take it from the fuzziness here, that's the bad one.
Yes, this is the abnormal hip. I mean, he's got severe arthritis on his X-ray. There's no space between the two bones here, so he's actually got bone, or had bone rubbing against bone, and there's all this new bone formation that's all part of the arthritic process.
And these
are his X-rays
the new
today.
improved?
Absolutely, new improved. This is the cup, and this is the ball. So again, it's this situation here shown on the X-ray, and it's bedding in very nicely.
And you've cut away the
new bone. Yes, we remove all the old bone because it just gets in the way and stops you placing the implant properly.
So, Leonard, how is the new hip a month along?
Well, I'm not exactly dancing down Clapham High Street.
Not yet, not on that crutch.
Not on that crutch, but we might get there soon. I would hope in a short time, a week or two, to be gently some nice little rolling hills somewhere along.
Well, I know you do enjoy your walks, don't you? I mean, how frustrating is that for you not to be able to do that?
It's frustrating to a limited degree, but I've been very lucky in sort of having the common nearby, and I like to read, and I can be fairly self-contained.
Well, enjoy the reading, and I'm sure in a few months' time you'll be running around.
In a week's time.
Thanks very much for talking to us,
Thank you very much,
Leonard.
Aaron.
Thanks, Marcus.